everybody, and welcome to the second forum on behalf of many partners throughout Mildura, obviously relating to our current COVID event and current COVID situation. My name is Terry Welsh. I'm the Chief Executive Officer of Mildura-based Public Hospital, and it's my pleasure to be your host again tonight. Just a few housekeeping matters before I go to the Mayor. Please, can you all be on Zoom, if not speaking, just for the benefit of everybody listening? And I remind everybody that we are on Facebook streaming as well. So from that perspective, we will take questions and comments both through the Zoom link and also the Facebook link. It gives me great pleasure now to hand over to the Mayor, Mr. Jason Monica, for acknowledgement of country.
Thank you very much, Terry. I would like to acknowledge the traditional owners and custodians of the lands on which we are meeting this evening. I pay my respects to elders past and present and celebrate and respect their continuing cultures and acknowledge the memories of their ancestors. Thank you very much for being here tonight, everybody.
Recording in progress.
If you are not speaking, thank you. We've got some background noise, please. Please also be mindful that last time we had 2,700 people viewing this stream and comments were overflowing, and we ask people to be conscious of that. I remind everyone this is not a political forum. This is a forum to update on our current status and where we're going for our COVID event. So I ask everyone to please be respectful in their comments and questions to our speakers tonight. I'm hoping he's in the forum. I'm going to welcome Jerome Weimer, of course, who is Victoria's COVID Commander. Okay, while we wait for Jerome to join us, I apologise about that, but this is technology. I'm going to go to Dr. Brucelbolam, who we met on Monday night, of course, who gave us a tremendous insight. And Bruce is the Director of the Loddon Mallee Public Health Unit. Bruce, thank you again for being here.
Thank you, Terry. G'day, I'm Brucelbolam, the Director of Loddon Mallee Public Health Unit. And I'd also like to acknowledge the traditional owners of the land on which we're meeting today. I myself am on Djadja land here at in the Bendigo region. I acknowledge Aboriginal elders of the past, present and emerging, and the great work of many Aboriginal people during this latest outbreak, and of course any Aboriginal people with us here today. So I'll just give a bit of a situation update from the perspective of the Public Health Unit, working with many different partners over several weeks and months, but particularly in this last week in response to the outbreak and then the subsequent lockdown. So to put this in context, I'll just start with a few statistics. We currently have 159 cases. We had 23 new cases yesterday, and those cases are spread across 88 different households. Now, as the outbreak progresses, we would very much hope that the level of household transmission between households starts to decline. At the moment, it's still increasing, and it probably will do for some time yet. But that's the statistic that will become more relevant as the outbreak in Mildura progresses. In terms of the demographics involved in that, the vast majority of cases that we've seen to date is among the under 50s. We've only had 11 cases amongst the over 60s to date, and that's very good news because we know that more severe outcomes are definitely associated with, on average, older age. So seeing a relatively low number of cases in over 60s is good news. It also reflects a relatively high level of vaccination for much of the population, because obviously those vaccines have been most available for the longest period of time for the oldest age groups, because obviously they're the ones at the highest level of risk of severe disease. The average age of people of cases in the outbreak is currently 27, although the range is very broad. We've got everything from very young infants right the way through to people in their 80s. But I would particularly call out that often we're seeing lower levels of vaccination, partly because of that less period of time that younger cohorts have had, younger groups have had a chance to get vaccinated. But particularly we're seeing the most significant single age group is amongst the 20 to 29-year-olds, and particularly females. And we've been obviously investigating this. It could be to do with a better level of testing in this group. It could be to do with some of the vulnerable situations that some young women within our community experience. So that's something we're looking into in further detail. Turning then to activity that's been going on in the recent, oh, sorry, I should also point out, there has been some real challenges in our data, identifying particularly Aboriginal identity within our data. That's something which is common in many health statistics, but the best information that we have to date is that approximately 1 in 3 of those cases come from Mildura's Aboriginal community. And obviously that's a highly vulnerable community, and one which an enormous amount of work has been going through to being led by great Aboriginal organisations and Aboriginal leaders in Mildura to help empower that community in response to this outbreak. So moving then to activity that's been taking place, and there's been an incredible effort put in by many different agencies, many different individuals and many community members to making a difference on these statistics. But in the last week alone, we've seen right the way across Mildura testing available not just through Bendigo Health Site, which of course the Public Health Unit is directly responsible for, but also organisations such as MDAS, Barrett Smith, Sunraysia Community Health Service, and a range of other organisations. Approximately 4,000 tests in the last week alone, which is an incredible level of responsiveness that people have seen in relation to the lockdown and then getting tested when you've got symptoms. Finally, and probably most importantly, and I'm sure Joanne will go on to talk about this in some more detail perhaps, we've seen a huge increase in vaccination rates over the last week to 3 weeks. To put this in context, 3 weeks ago, approximately 77% of the eligible population over 16 years of age in the entire in the entire Mildura local government area had been vaccinated with a first dose. Currently, we're now sitting at over 90% for the entire rural shire, which is an incredible achievement. And to put that in context, that's over 3,000 vaccinations just in the last week, almost a 7% increase in the population being vaccinated in the last week, which shows what an incredible degree of engagement and support the community have had in relation to this lockdown and in response to this outbreak. So I thank everybody here for the incredible work that you've done, and everybody who's not here, all of those who encourage vaccination or been vaccinated. It's an incredible difference that you're making. However, that does break down when we look at the specific situation within postcodes within Mildura. Vaccination rates are not as high as that overall picture would suggest. So when we look at central areas such as Redcliffs and Irimple, we see very high levels of first dose vaccination, between 80 and 80+% for eligible people. However, when we go to Merbeen, Mildura North, Mildura South, we see that still there in those areas, 1 in 4 people have yet to receive, eligible people have yet to receive their first vaccine. And of course, that is where we want to be focusing much of our effort to try and protect people as rapidly as we can while we trace and investigate the cases as they occur, isolate and quarantine people as effectively as possible to make sure that they don't spread unintended spread across the community. And in the meantime, we keep our vaccination and testing rates as high as they possibly can. So I'll conclude there and just thank everybody for your incredible engagement and the incredible rates of participation in testing and vaccination that we've seen over the last week. I thank you.
Bruce, thank you, and you've been a tremendous support to all of us on the ground here, and I thank you for that. I believe Joanne has joined us, and Joanne, welcome, and again, it's terrific to hear from you as our Victorian COVID Commander. Joanne, thank you and welcome.
Great, good day, Terry, and good evening, everybody. Apologies for being late in. I was struggling with the Zoom link. I'm better at the in-person thing, but can I just acknowledge the traditions of the lands on which we're gathering and pay my respects to elders past, present and emerging. So I'm back in Melbourne and pleased to be back with you electronically at least to get a sense of how things are going. And I've heard most of Bruce's update, which covers pretty much the same territory I was going to cover, which is just as well. But suffice to say, look, I think our statewide position, or certainly down here in Melbourne, things are clearly still pretty unpredictable. We've had a very high caseload number for the state as a whole today, over 2,000, almost 2,300 cases in a single day, vast majority of which is in Melbourne. But we are seeing an increasing caseload across regional Victoria. So we've got significant case growth in Gippsland, in Shepparton, in Bawbor, but also, of course, we're still seeing significant cases coming through in Mildura. At this distance, my sense is that we've seen a phenomenal response on the ground over the last 5 or 6 days. And again, a huge thanks, Terry, to you and the whole team at Mildura Base Hospital, to Bruce and the team across Loddon Mallee, but also to Jackie at Madass, Simon at Sunraysia Community Health, and Martin at the team at the council, and many other organisations. It's really been very impressive to see the response on the ground and the support being given to those, almost 170 odd people that are now with COVID in the wider Mildura community. And we are seeing, some linked cases, of course, in Robin Vale and in Swan Hill. So a huge effort going on the ground to support those people, which is amazing. Phenomenal testing results that Bruce has alluded to, and even 1,500 tests yesterday. Just really great numbers coming through that gives us a really good picture. And we're seeing this kind of steady stream of 20 or so cases a day now over the last 3 days, which is of course a little bit troubling. In terms of the key point that I know, Terry, you're going to ask me, so I'm going to just jump in ahead of the question, is what happens to the lockdown? It's due to finish tomorrow midnight. So what's going to happen there? We have a series of reviews that will take place tonight, but also tomorrow morning. And I hate to leave it so late, but if I'm honest, we would love to be in a position, Bruce and I, to see the numbers coming down steadily and be dealing with quite low numbers at this point. We're not quite seeing that yet. We're very keen, and Brett Sutton, who I'll be seeing later on tonight and tomorrow, will be keen to see what the numbers look like again in the morning. For the avoidance of doubt, we do not expect to get back to zero. So we are not on some mission to get back to 0 cases before we open up. And, if you look at the settings we have around the state, generally speaking, we will try and open up as soon as we think we're confident to do so. But there's obviously a number of factors in play. So with I'd love to have the answer now. I'm afraid I don't. We'll review it late tonight and tomorrow morning, and I'll be on with people as soon as I can to let them know what that's going to be. But I think for tonight, I'm afraid it's a line ball call still, but we'll see how we go. And then finally, just on the vaccination question, and again, as Bruce has said, 91.5% vaccination rates across Mildura as a whole for those 16 and over. That's phenomenal. But the fully vaccinated numbers are a bit lower, actually. So 56% of people in Mildura have got both vaccine doses. So actually it's below the state average. And I'd really encourage people to get their second dose done. Now, as Bruce has said, we've seen a big rise in vaccination rates in the last couple of weeks, which is fantastic. So I'd expect to see a bit of a lag on second doses. But again, please come out and get your second doses. We are now starting to work very closely with Jackie and the team at Madass to really start to do in-reach vaccinations to support people. That will be happening over the coming days. And we will maintain that vaccination presence for the whole community. Certainly over the next 3 or 4 weeks, we're very keen to get that vaccination, give everybody the opportunity to get vaccinated and to make sure people do, so we can really kind of turn the page on this outbreak. Terry, with that, I might just hand back to you and look forward to joining the questions session.
Thanks, Joanne. Really appreciate it. And we are cognizant that you have to go to another forum soon, so we will get to you very shortly. I welcome Dr. Thomas Schultz, who's going to present for us now. Dr. Schultz is the Infectious Diseases and General Physician, Senior Medical Advisor, the COVID-19 program at the department. Welcome, Dr. Schultz.
Thank you, Terry. Thanks for the opportunity to speak tonight, and also to recognise the traditional owners of this land on which we all sit this evening. So both Joanne and Bruce have recognised the importance of vaccination and outlined the good work that people are doing in terms of vaccination. And of course, as we go towards the 80% and beyond double dose goals, the most important thing is really that everybody comes with us, because having small populations that are under-vaccinated, they become the groups who are at most risk of ending up in hospital and ending up really unwell. Just to look at some figures, I think last night in Victoria, there were 92 people in intensive care, and 82 of those people were unvaccinated. So the COVID vaccine really works. It works to keep you out of it. The primary reason to have a vaccine is to stop yourself getting really sick and to stop yourself ending up in hospital and in intensive care. And we are seeing right now in Victoria with the Delta strain that the vaccines are working really well. Sometimes there's lots of rubbish on Facebook and lots of other nonsense that might suggest the vaccines are not working so well. But, you know, the figures right now in Victoria, right at this moment, are very strongly supportive of the vaccine. We also know that there is significant other benefits in the vaccine. So that is reducing the likelihood that you get COVID, but also reducing the likelihood that you pass it on to others. And that's a big reason for a lot of the mandating and, you know, really requesting people, requiring people to be vaccinated now, so that we, for the benefit of all Victorians, get vaccinated. There's 3 vaccines available. The newest one that's available is the Moderna vaccine. People may not have heard a lot about Moderna vaccine. It's a very similar cousin to Pfizer. They are both what are called mRNA vaccines. Both have very similar effectiveness. And by that, I mean more than 90% of people, more than 90% effective against getting severe disease and ending up in hospital with COVID. They both can cause some side effects at the time of administration, with fatigue and sore arm and headaches and so forth. But those side effects resolve. They're annoying if you get them, but they do resolve. Very rarely, there's an occasional condition called myocarditis, which is inflammation of the heart muscle. But 99.9% of people who get these vaccines don't get this major side effect. And I think we've always got to be aware that sometimes in Australia we can forget a little bit that COVID's a terrible disease, and people die from COVID, and huge numbers of people have died from COVID around the world. And when I put on my clinical hat and work at the Royal Melbourne, you know, yes, it's more likely if you're elderly. Yes, it's more likely if you have other medical conditions. But there are people in their 20s, 30s, 40s in hospital needing oxygen, and those people have not been vaccinated almost universally. So just really to emphasise that. And look, one point, occasionally, one of those Facebook sort of myths that circulates out there is that somehow the vaccine affects people's fertility. And there's now good studies to show that for both male fertility and for female fertility, there's no impact on fertility. And in fact, for pregnant women, so that's obviously a bit beyond fertility, but for pregnant women, there's very good evidence that having the vaccine is safe for the mother and the baby, but more than safe, it's really beneficial, because COVID in pregnancy is a nasty disease. And some of the people who are in intensive care are pregnant women. And, you know, clearly if you're pregnant, the last place you want to be is intensive care for the well-being of you and also the well-being of your baby. I might leave it there. I'm happy to take questions on vaccine and so forth. Thank you.
Thank you, Dr. Schultz, and really appreciate that. And I think people starting to put their questions into the chat. We will come to them shortly. We've got one more speaker and then we will get to questions. And I welcome Sheree Jukes, who is our Mildura Rural City Council Manager of Community Care Services. Sheree, welcome to you and thank you.
Thanks, Terry. Look, thankfully, we're very well prepared for the situation we find ourselves in with so many people in mandatory isolation. And there's been extensive planning that's happened well before now. Local people we know are resilient, and we know that people are banding together to support each other. We're taking care of each other, and that's something that our community really prides itself on. Families and friends, family members and friends of those who are isolating are helping out in any way they can, dropping off shopping and delivering meals and just checking in for a chat. But for people isolating who need more help accessing food and other essentials, there's really 2 main ways to get that support. So the first one is to call the state's coronavirus hotline. So 1-800-675-398. Listen to the options, but option 4 is to request relief, including food. So if you need urgent support, or if it's outside council's community relief service hours, this is really the best way to access that. The second way is to contact the Mildura Rural City Council directly, so 5018-8100 between 8 and 5 on weekdays and 9 and 6 on the weekend. Or if you can jump online, and at the top of Council's webpage, there's a red banner which takes you through the information about relief supports available. So when you contact Council's Community Relief Service, you will be talking to a local person about your individual situation, and they'll work with you to access the supports that are available to you. So those supports and assistance include food parcels and cooked meals, personal care items, baby care items, medications. They can assist you to complete online shopping, and they can help you organise picking up, click and collect. They can also help you access health services, housing services and emotional supports. And we know that there's people out there experiencing the impact of COVID-19 who have never ever needed help and support before. And we know that navigating the system can be really tricky, especially if you're stressed or if you're under pressure, and in this case, perhaps even unwell. So our team is available to help you navigate the system. And we're working alongside many other organisations and agencies in the community to make getting help as easy as possible and as quick as possible. I just want to quickly touch on demand. So on the average day, the Sunraysia Food Hub, which is situated at the Sunraysia Mallee Ethnic Communities Council, provides about 50 to 80 food parcels every day. This week, they're distributing about 120 each day, and of these, about 25 to 30 are in mandatory isolation, and others are experiencing financial hardship. The food parcels do vary according to what's available at the time, but in general, they include pantry items such as pasta, rice, pasta sauce, breakfast cereal, long life milk, sugar and soup, as well as fresh fruit and vegetables, bread, eggs and pre-cooked frozen meals. We have been listening to community feedback and requests for items such as tin tuna, tin braised steak and vegetables and other tin meals, which are really easy to prepare, have been purchased and they're now included in the packs. We're sourcing as much food as possible from local suppliers and growers to ensure really good quality produce is provided, and also to support our local businesses. We're incredibly thankful to the Red Cross. They're sending up additional pre-packed food parcels and they're also helping to distribute these. All of the deliveries, I want to reassure people, are made using contactless delivery. And I really want to thank the team who are out working really hard to get the parcels out quickly and safely. So please, if you do need assistance, just call us. We're here to help. Thanks, Terry.
Great message, Cherie, and thank you to all of the people who have just presented. Really appreciate it. I'm going to go straight to some questions because Joanne does have to go. And there's two I want to ask. The first one is the program of pop-up testing sites and vaccination sites. Joanne, are you able to touch on that? There was a specific question about Merbeen, but I think if we cover it more generally, please.
Yeah, Terry, I can, and I'm not sure the details have landed yet, but what the teams are working on, and we're working very closely, particularly with MEDAS and with MVAC and other local partners, is to arrange, well, two things really. One is to arrange for some additional pop-up vaccination facilities closer to those, as Thomas said, closer to some of those community areas where we're seeing lower levels of take-up so far. And we are starting to really hone in on those postcodes and those suburbs where we're seeing lower levels of vaccination. So they will be rolling out over the coming days. And that'll be part of, I think, about a 4-week vaccination drive where we really support people to get those vaccination things done. Where necessary, we will go door to door and be really quite localized around that approach. And obviously we're working with local community leaders to really get that right. In the meantime, for all of us, there's a number of other places where we can get our vaccination done. There's a couple of vaccination walk-up sites already in town, and of course GPs and community pharmacies have got access to vaccine as well. So I would encourage anybody who's on the call if you haven't had your first dose, then please, as Tom says, you've got Moderna available through pharmacies, and we've got Pfizer available through GPs and the state clinics. And if you haven't had your second dose, please book that in as well, please.
Agreed. Thank you, Joanne. And if we can just have one follow-up to that, there are a number of comments about the time frame between first dose and second dose vaccination. Can you just touch on that, please?
I can. I'm going to read out the advice from Dr. Tom Schultz because he'll be right and I'll get it wrong. So we follow sort of national advice and guidelines on this. So if you're on the Pfizer vaccine, it's a 3-week interval between the first dose and the second dose. So you can, as soon as you've had your first dose, 3 weeks later, you can have your second dose. I'd really urge everybody to try and make that 3-week, make it a 3-week thing rather than a 4-week thing. If you're on Moderna, which is mainly through community pharmacy, it's a 4-week interval, so slightly longer interval, so a different kind of vaccine. If you're on AstraZeneca, it's a 6-week interval. And I appreciate that's hugely confusing for all of us. Again, if you're going through your GP, they'll advise you what's right for you. If you're coming to a state clinic, it'll be either Pfizer 3 weeks or AstraZeneca 6 weeks.
Thanks, Joanne, appreciate that. Bruce, if I can come to you, there's a question about the current caseload and the cases we're seeing through Mildura and our surrounding community. What percentage of those people are vaccinated, or what's their vaccination status?
Yeah, so our data when we're doing the interviews, and I have to say with the volume of cases we're looking at, it has been pretty challenging. There's been a lot of great support from departmental colleagues from north of the border, New South Wales, helping us with those interviews, but we don't have vaccination status for all of those cases easily to hand. What we definitely can confirm is that in terms of the cases that become severely ill, has been alluded to a number of times tonight, hospitalizations and more severe outcomes are far more common amongst the partially or entirely unvaccinated population. So I think that's probably broadly mirrored in our numbers, but I'm afraid I don't have a particular statistic to share tonight.
Bruce, thank you and appreciate that. And we can push that out in the coming days to that question. Got a really good question here. They're all good questions, but this is very pertinent to where we're heading this time of year. It says we employ a large number of seasonal workers. We've had seasonal worker questions on Monday as well. If all vaccinated as a casual workforce, if someone tested positive, what would that mean for the farm and the contact tracing? Joanne or Bruce, I think I'll go to you, Joanne, on that one, please.
Yeah, Bruce will probably give you a better answer than me, but I'll give it a shot anyway. So the short answer is it depends really on the COVID safe plan that the farmer's got and the size of the farm and how closely the workers are working together. So one extreme, if all your workers are in the same dorm, sharing the same food, sharing the same kitchen and the same common areas, and working together all day, then yeah, they're all going to be primary close contacts, and you have a risk of them all being isolated. If you're managing them in distinct workforce bubbles, so smaller, less contact with each other, better ventilated spaces, less sharing of food and those sort of things, then you have a far better chance of being able to reduce the number of primary close contacts and minimize the impact. So a lot of work, and there's a lot of advice available from our teams to help businesses manage the impact of COVID and run those COVID safe plans. So that should really be a focus, I think, for every employer. While I'm on, Terry, can I do one cheeky last one? There's a great question up here from Lynn about what if your employer doesn't want you to have the vaccination, but you get a message from the Department of Health you've been exposed to COVID and been asked to isolate, and your employer threatens to dismiss you. Look, when the Department of Health or any of us come to you and say you are a primary close contact, you are required by law to isolate. It is not an optional thing, because you are potentially at risk. Your own health is at risk, as are that of the people around you, including the people at work. If your employer does not respect that, they are duty bound by law to do so. And I'd be straight off to, if they don't see sense, I'd be straight off to either Fair Work or my lawyer, or somebody who you can support, who can support you to have that conversation. If that situation is real, that's a really difficult situation, and I would hope that any employer knows better than that. And please put them in touch with us if you think that would help.
Yeah, thank you, and I appreciate you have to go. So one more question, Joanne, if you don't mind. It's from an accommodation provider. So once we open up in Mildura, very big tourist area, will we only be able to accept fully vaccinated people from across interstate boundaries? I think that's referring to.
Look, it's a moving feast at this point in time. So as we stand there today, we have not made any directions to that effect. So the only directions around mandatory vaccinations are for those of us who are essential workers and still moving around. We are required by law to be vaccinated under the Chief Health Officer's directions, and there are various timelines for doing that. There is no mandate at this point for people who will start moving around into tourism accommodation, and I'm not aware of any impending directions to that effect. So I think that's unlikely. Obviously, we'd encourage people to be vaccinated. I think you will start to see some guidelines around what businesses can do, and we're doing some of those trials now, including down in Bullock, around the vaccinated economy and making it easier for people who are vaccinated to get access to those services and to have greater freedoms. And with that, Terry, I'm afraid I need to go, but thank you so much for giving me a chance to speak to you all again, and hope to see you all soon. Thanks very much indeed.
Joanne, appreciate it, and we're very grateful for your time. We're going to go to some Facebook questions now, and as we did on Monday night, Mike is going to read them out for us. So, Mike, I'll hand over to you. Thanks very much.
Thanks, Terry. We've got more than 1,000 people tuning in live at the moment on Facebook, and lots of questions. The first one is similar to the first question from Facebook on Monday. How many people are currently in hospital here in Mildura, not counting those in hospital in the home?
There's 4 currently within our facility that we are caring for. We are also streaming actively to Bendigo as needed as well. Thank you, Micah.
And what measures are being considered for the spread of COVID to towns like Swan Hill, Kerrang, Echuca, Moama and beyond?
Great question. Bruce, I might go to you for that one, please.
Absolutely. So obviously it is significant concern that in recent days we have seen an increase in cases, and it's pretty clear that there are some links there between what we're seeing in Mildura and down into Robin Vale and Swan Hill. We have been regularly meeting through the emergency management arrangements with a number of community leaders and organisations in those areas and drawing up plans associated with that. At the moment, the situation is relatively under control. There are some great plans in place. There's some enhanced capacity for testing and vaccination, which is being implemented. And I think, you know, we're at a level here. Sorry, someone's just come off mute. If you can put yourselves on mute. Thank you. Yeah, we've got some great plans in place, a lot of work happening currently to keep the community safe, and let's try and keep those cases as low as we possibly can for as long as we possibly can. They're still in single digits in Swan Hill and in Robin Vale, and we want to keep it that way as long as possible. I'd also note as well, actually, sorry, that both those areas have got comparatively strong vaccination rates for much of the community as well. So while vaccination is a big issue, which we need to push on everywhere, some of the largest challenges I think probably are here in Mildura to some extent.
Thank you, Bruce. Joanne, who's on the Zoom call, can I ask you to mute, please? You not on mute from that point of view. Bruce, you might know this, or it was a question we can carry to Jerome around LGA, and if we remain in lockdown, are you aware of any consideration for a partial LGA lockdown? I haven't heard of it elsewhere, but interested in what you might know.
Yeah, look, I think that's probably a question more for Jerome than for I, but from a public health perspective, I think the big question, of course, is as we move out of an elimination strategy where we're looking for 0 cases, we're no longer looking for 0 cases, as Jerome said. So I think everybody in the world of public health is thinking very hard about how do we stop the spread without having lockdowns or with having minimal restrictions. So that's something which is very much a live piece of work. Whether or not that would apply in the current situation, I honestly couldn't say, but I can certainly say that many of my colleagues and I are discussing those issues with regularity, because we're clearly going to see a need in the future for change restrictions in some context, but we're not going to be looking to go back to lockdown in the way in which we currently are, I think.
Thank you, Bruce. Tom, a question for you about supply. It's been a constant question, I guess, through the whole program. Where are we situated today in terms of supply of vaccine, please?
Yeah, no, finally it's good. So for months, sort of that being a real issue, we can finally say that supply is good. And through the state system, you can book in a matter of days. Most GPs will be able to get you a booking pretty quickly. And many pharmacies have walk-up availability of Moderna. So hopefully getting it, you know, the availability has finally, thankfully, no longer the issue.
Tom, thank you. That's tremendous news, to be honest. There's a question here, a really good question, not quite pertinent to our current situation, but very relevant, about booster and the need for a booster vaccine. And the question is, do you have to have the same one as well?
Yeah, so good question. We expect that at some stage a recommendation for boosters will be made. ATAGI, who's the body who makes this advice, is actively considering this and said they'll tell us something by the end of October, possibly sooner. Internationally, the US, the UK, Israel have gone to boosters. Now, they did start their vaccine program 2 or 3 months ahead of us, so they're sort of into the boosters, but also they were into the initial vaccine. So we're not kind of at the point they were at in terms of needing boosters quite just yet. Now I think I've got going on boosters. And what was the exact question? Will they be the same dose? Yeah. So the current thought is that they probably won't. Again, we'll wait for ATAGI to make final advice, but currently for your first 2 doses, it's the same. So Astra, Pfizer, or Moderna. But for the third one, it will probably be flexible and based on availability. We'll wait for ATAGI to give us the final word on that.
Thanks, Tom, for that question. We are getting a lot of employee and employment-related questions that I think we almost should take on notice around if people haven't had their vaccination by a mandatory date and so forth. But Bruce, I think the guidelines are very clear around those timelines and when the requirements for mandatory deadlines.
Yeah, absolutely. I think definitely we can take those questions on notice, but certainly there's very clear and crisp timelines around that. Obviously, it is. I don't like it. I don't like being told what to do. Lots of people out there don't like being told what to do. Absolutely understand that. A determination's been made, and the determination is very, very clear. If you're an authorised worker, we've seen too many outbreaks and cases linked to unintentionally people doing their jobs and spreading the disease. And the determination is to keep ourselves safe, to keep our community safe. If you're doing those jobs, unfortunately, yeah, it's mandatory. And really, that's just the ruling that it's there. And yeah, I don't like being told what to do, just like anybody else, but we're in the middle of a pandemic, and that's the determination that's happened.
Bruce, thanks for that advice. Tom?
Oh, yeah, just to add to that, I completely agree with Bruce, and I don't like to be told what to do either, but we've all had so many freedoms taken away for us over the last 18 months, not being able to go to funerals, not being able to go to weddings, not being able to contact and spend time with our loved ones. That, to me, this restriction on our freedom actually gets us freedoms back. This is the way to get us out of so many other restrictions that have come upon us. So I think it really is a balance. And if you look at it through that light, maybe you think, well, it's actually a way to get more freedoms, although it does take away the choice.
Thanks, Tom. And I think we're seeing it firsthand from the caseload and vaccination and the impact on health. So I'm sure people are all weighing that up. Bruce, I want to come to you. It was a question that was carried the other night and is popping up again around schools and the like. When there is a case at a school or a primary close contact, what should parents do? What's your advice for the community about managing that? Because for parents, my belief is, I don't have kids up here, but I think they just get a text message. How would you advise them to manage that?
Yeah, I'd firstly be saying go, and check the information from the most authoritative sources. And of course, that's from departmental advice or advice coming forward from your school. Texts from Department of Health, of course, are included in that. It is really, really vexing for people currently. And there's a big gap between what people are saying in the street or around the schools as to the flow through of official information that's coming through. I wish that could be a lot quicker than it is, so that confusion on the ground can be bottomed out as quick as it can. Unfortunately, it's just literally a matter of the person hours and the flow of information to be managed, which is making this really, really challenging. And we just ask parents and schools to stick with us. Obviously, it is concerning when we get cases in schools. The intent is that it will be as minimally disruptive as possible and that we will get kids back to school as quickly as we can. So obviously when these disruptions do occur, it is confusing, it is concerning, but we're trying to make that gap between what people know on the ground and the authoritative advice coming forward as short as we possibly can be. Terry, just to note as well, actually, I was just going to pick up on a point that Tom was dealing with earlier. In terms of supply, it's been great. The department have actually, in the last couple of days, just been shipping up to us another 2,300 doses just in relation to the Mildura, Robin Vale, Swan Hill response, in reflection of the incredible demand that's been happening in the last period. So certainly we're working through those supply chain issues that have been a big challenge previously.
Bruce, thank you. And we are getting a lot of industrial relations questions that I promise you we can't answer tonight, but it is something we will take away and move forward with. Hey, Micah, what's happening on Facebook? Any themes coming through?
Yeah, plenty happening, Terry. When will children under 12 be able to get Pfizer?
Tom, are you there for that one?
Yeah, can take that one. So the answer is we don't know yet. It will be reviewed through the Therapeutic Goods and ATAGI, and they will make recommendations. I think that the question of vaccine in under 12s is, it's a bit of a different balance to over 12s, because really under 12s very rarely get really sick with COVID. It's really very rare. So then you're balancing between a vaccine, what's the benefit to the individual and what's the benefit to the community in terms of reducing transmission and so forth. But if I can be very reassuring to those of us and to those of you who have kids who are going to be going back to school next week or the weeks after, that may be concerned that their kids will get COVID, it is a very mild disease in kids. So the evidence from Pfizer overseas is that it reduces that, the vaccine produces an antibody level, but we haven't yet seen the trials to show that it has what we call clinical effectiveness, that it definitely stops COVID in young kids. So I think there's a way to go before we have enough evidence to start recommending it in kids. I doubt it will be before the end of the year, but I've been wrong many times in this pandemic.
Thanks, Michael. Let's go a couple more from Facebook.
How are there only 5 exposure sites for over 100 cases in Mildura? I know the government is only posting tier 1 sites, but surely with more than 100 people, there are more than 5 exposure sites.
Bruce, we'll throw it to you for that one. Thanks very much.
Yeah, absolutely. So exposure sites still, of course, are a major part of the investigations that we do in response to any case. We are only publishing the ones as obviously is recognised now, where there is public health significance, i.e. we don't know that everyone has, we can't guarantee that we've got in contact with everybody who's been to that exposure site, that it could be a significant exposure site with a lot of different close contacts. Those are the only circumstances that we're focusing on now. We're really drilling our effort into where we know it makes the most difference. And that's why I was earlier dwelling on, for example, the household contacts. That's by far the most important site for transmission for many infections, including COVID in many of these outbreaks that we're seeing to date. So certainly people should be reassured that we're looking at exposure sites. We're thinking about them all the time. We're publishing the most important ones. It is a difference from how we've been managing it earlier, but the approach that we're taking now is focusing our efforts towards where it'll make the most difference. In particular, for example, in Bendigo, when we had 2 large exposure sites in the major shopping centre there in Bendigo Marketplace, we did 3,000 tests in the subsequent 2 days, an enormous effort, enormous inconvenience for very many people. From that huge effort, which was excellent in response to that, we actually identified 0 cases as a result of that. So that isn't to say that that effort was not worthwhile, but it just demonstrates that as this disease gets more prevalent in the community, we need to focus our effort where it will make the most difference. And just publishing exposure sites and driving huge numbers towards testing isn't necessarily always the most effective thing to do if we know we need to be focusing our effort more narrowly, which we seem to be doing, or we seem to be needing to do during the current phase of the pandemic.
Thanks, Bruce. And that's been, I'm not sure who asked that question, but that's been a transition for all of us. We did get in the habit of looking at those exposure sites and reacting accordingly. So it is a change in behaviour. We're all, us at the hospital included, are learning. So Bruce, thank you for that explanation. Michael, let's go one more on Facebook.
Yeah, I'm off mute. Is wastewater from smaller towns tested? For example, Oyen.
Never been so much interest. There's never been so much interest in wastewater. Bruce, can you cover that one off?
Yeah, so look, there is obviously the department runs a wastewater testing program that kind of regularly rotates around based on the degree of risk we're seeing within a given community. So for example, just in the last sort of 24 hours or so, there's been a number of unexpected wastewater positive results in Bendigo. And of course, that then leads us to do more enhanced surveillance in those areas to try and see, is that just an intermittent signal or is that a real signal? For some of the more rural and regional places, there can be a much lower intensity of testing. Sometimes that is also a reflection of the fact not only are there lower risk in those communities, smaller communities, but also, of course, many people live off the reticulated water supply. So it doesn't necessarily mean that, that we get as authoritative a view of the early situation in those shires. We've got to rely more on testing for symptomatic people in those environments. So it's certainly something which is regularly looked at by the scientists at the Department of Health and elsewhere and thought about very hard. but usually it is focused more in the larger population areas than in the smaller rural areas.
Bruce, thank you, and appreciate that. Tom, I know you have to leave us. Is there any final message you'd like to give to our community?
Look, you're doing a fantastic job. I think, this has been a very long pandemic for everybody. And it's hard to keep following all the guidance, the social distancing, the mask wearing and everything. But the vaccine does offer the pathway out of this, and listen to the people, trust the people who tell you that it's good to get vaccinated. I know people get a lot of information that, we're speaking on Facebook now, so I can't say Facebook information's bad, but all sorts of information from all over the place. And it's particularly difficult if you get information that's bad information, but from people you trust for other reasons. So just try and sort of sift through it. And there's a lot of fear, but for those of us who are clinically managing people with COVID, there's a lot more to fear from getting COVID than from getting vaccinated.
Understand. Thanks, Tom, for being with us tonight. We're very grateful, and we wish you a good night. Thank you.
No problems.
There's a really good question here, Bruce, around if a small group of workers living in the same accommodation and working together tested positive and are required to quarantine for 14 days, do the other workers who are on the same site but have tested negative, are they required to isolate as well? This is the primary, secondary conversation.
So this varies a great deal, and this is where our contact tracers really come into their own, because it does vary so much for the individual workplace, for the individual concerned, the individual work site. So there's no hard and fast rule. The hard and fast rules, which definitely always apply, is if you are a close contact of somebody who's got COVID, you will need to get tested, to isolate, to stay at home, to quarantine at home, and to stay there all the way through that period, get tested on day 13. Hopefully that comes through clear, and then you can leave. And that's really just it's a reflection of the biological reality that when you're working closely together with somebody over a period of time in an enclosed environment, particularly, there is a relatively high risk of exposure. After that, the level of risk does drastically reduce. There still is risk there for what we call our secondary contacts, or more easily to understand, just casual contacts, people who may just have walked through a workspace or been, vaguely in the area of, rather than in a focused face-to-face interaction. And those people are at significantly lower level of risk. Now, those people need to still get tested and need to isolate until they get that test result. But then after that, we're now saying basically people can kind of get on with their lives. This is to do with basically the changing nature of the epidemic that we're in. We now have a situation where we are moving into a circumstance where COVID will be part of our lived reality here in Australia going forward. We're no longer living in a world where we're trying to completely eliminate the risk of COVID ever spreading. And frankly, with that background, too many people get impacted if they're secondary close contacts, if they're casual contacts, they have to isolate, society has to shut down, businesses have to close, all of those different impacts when we know we're going to be getting cases going forward. So the practice reflects the biological reality that they are at lower risk, and also the fact that we are going to be looking towards a period where this, unfortunately, sadly, is going to be part of our day-to-day lives going forward. Happily also, I think, a big qualifier to that too is if people are vaccinated, the level of risk of getting COVID, obviously, from people is drastically reduced. It's not reduced to zero, but it's very significantly reduced. So as we get those 80%, those 90% of people with a first dose and rapidly moving towards that for a second dose, the level of risk faced to the general community, if you're not a close contact, is going to be reduced. So looking at those rules in workplaces particularly is the job of the contact tracers who would contact that business and those workers concerned. And the rules will change over time because the nature of the battle that we're facing against the bug as it evolves and our resistance to it evolves will continue to change. I appreciate that can be really confusing for people, but the best thing to do is follow the authoritative advice that it's available through the Department of Health website, or when you get contacted by people from the Department of Health, obviously provide that information. They'll give you the best advice possible.
Thank you, Bruce. Sheree, a question for you around volunteering and support from the community, and can they get involved with volunteering for food delivery or whatever it might be? Just appreciate your thoughts there, please.
Yeah, I think there's two ways of dealing with that, and I don't want to overwhelm the Sunraysia Mallee Ethnic Community Council with a huge amount of phone calls. I think the best way is probably to ring Council's customer service number and let them know your interest, and we'll collate that and we'll work with SMEC and other organisations. My answer is yes. I think we're going to need some help to do this, particularly when we open up, and organisations like SMEC are always looking for volunteers.
Couldn't agree more. And I think, you know, that always with a risk perspective, but well done. I think you're on the money. A huge amount of questions about pay and the like that I'm going to ask us to take offline. And even if we have to run a few bulletins in papers, we can answer a number of those questions from that point of view. So Michael, I'll come back. We've got 8 minutes left. What are you seeing on Facebook, please?
Thanks, Terry. A question around working with our cross-border community. How are you working with New South Wales in identifying contacts that may live on both sides of the border?
Thanks,
sure,
Bruce.
so I can, yeah, absolutely. So yeah, we're in constant communication with our colleagues north of the border. They've been a fantastic supporter of the actions we've been taking here, and we're monitoring the situation very, very closely, of course. We do know that in north of the border they are getting, or north of the river, I should say, they are getting cases, of course, which reflects the reality that people have moved around between these communities for some time for legitimate reasons in the vast main. And it's something that we work on very closely together. I think it's in the interest of New South Wales, of course, their case numbers are significantly lower than ours, to make sure that our controls on this side of the border are operating highly effectively. So we're in literally daily contact when we do identify cases, in some instances on this side of the border, and in some instances on the other side of the border, that we then figure through the necessary public health actions as a result of that.
Couldn't agree more. Micah, any more off Facebook there?
Yep. The next one I've got is in regards to early birds who were double vaxxed some months ago. Do we plan on a booster anytime soon? Probably a good one for Dr. Tom, who's left us.
Well, I think Tom did touch on that. Bruce, you go, but Tom did touch on that, so good question.
Yeah, no, I think Tom broadly covered that before, which is, in all likelihood, at some point, boosters will become part of the schedule. The advice hasn't been determined on that nationally by the expert bodies associated, but that's what we're anticipating. And obviously, the longer the interval between people's initial 2 doses, and then they'll kind of, in inverted commas, probably be the earliest ones to get vaccinated with any boosters or to be invited for that. It's also going to be, of course, limited by availability of supplies. So there's a lot of factors going into that, but in all likelihood, there will be boosters on the horizon. No public, no final advice on that from the national bodies yet then.
Thanks, Bruce. We'll await that, and with great interest, certainly. There's a question about accommodation, Bruce. It's a longer question to preface it. It's about the concern if someone is positive and going home, and this is specific to Robinvale, which I know there's plans happening. Just maybe talk through the system and how that works from that perspective.
Certainly. So obviously when we're notified of a positive case, one of the first questions we want to establish is where someone is living, the circumstances in which they're living, and potentially who their household contacts are. In many circumstances, people can isolate at home. They can stay in their room. They can use their own facilities. Maybe they've got a bathroom attached. In some instances, that's not possible. You know, where people have got houses with frequent comings and goings, we have to try and do our best to keep the cases separated from people who are not yet cases. That can be really challenging in the current environment, because with so many cases nationally and particularly in Melbourne, availability of accommodation has become a real issue. And the Department of Families, Fairness and Housing and many other agencies have done an incredible job trying to source alternative accommodation for in the most needy of circumstances. I'm happy to say that in the vast majority of instances, people can isolate very safely at home, posing minimal, if any, risk to any of their other household contacts or anyone else in the broader community. But in those rare circumstances where people's lives are going to be very, very difficult to keep safe on multiple fronts, of course, we look at that on a case-by-case basis. And I thank everybody who's been involved in that great work today in Mildura, trying to find alternative accommodation as appropriate.
agree, and I think it's front of mind for everyone for that community member asking that question. So, Micah, we've got one final question off Facebook.
Yep. The question is it possible that next winter we will be in the same place due to a new variant, just like with the flu?
Very good question. That is a very good
it's an excellent question. I don't really want to leave the forum on a bummer, but the only answer to that is yes. You know, it is definitely a possibility. I wish that wasn't the case. We are genuinely in a biological arms struggle against a virus which is evolving. And what we know about these viruses is they evolve very, very rapidly. As everybody's seen, we've gone through alpha, beta, delta variants. Within 18 months, that battle will continue to evolve. Happily, on our side, the armaments we're using against them, in particular the vaccines, are extremely nimble. So the new mRNA vaccines in particular are relatively straightforward, much easier than traditional vaccines to reprogram if we do see new variants evolve. I think it's going to be, unfortunately, just a reality that we're just going to need to accommodate to. Another piece which I think is probably important to note is we'll have to be watching very closely the Northern Hemisphere and what happens with influenza next year. We know that getting influenza and COVID together is very, very bad. And we, as we come to March next year, obviously we'll be rolling out our influenza vaccination program again. And, just reiterates the importance of the fact that we stay on top of our vaccinations as closely as we can. And I wish it could be better news, but unfortunately, it's going to evolve as a bug. And we just hope that in coming years, as humanity gets used to this bug, biologically speaking, the situation will settle down and it will be somewhat, for example, possibly more like an influenza type of a season than a stop society because we've got a new coronavirus variant. But there's just so many unknowns. We can't, acknowledging Dr. Tom's point before, only a very, very brave person would take any bets in a pandemic environment with all of the things that we've been disproven on. But yeah, it's certainly a possibility we could see new variants next year.
Yeah, I agree with that, Bruce. And we won't leave on that note. There are a few things that we will finish up on. I'm mindful it's 6:58 and we've committed to finish at 7. I think, first of all, to hear from Tom Schultz tonight, Dr. Tom Schultz, was refreshing in terms of the information around the vaccine, and I hope people can continue to absorb that message. I hope the community can continue to hear from brucelbolam and see why we work so closely with Bruce and Jerome as we work through this program. There are some key themes tonight that we will take away. We will continue through a number of mediums to try and help the community navigate primary close contact, secondary close contact, as it happens at schools, as it happens at farms, has been asked tonight, and obviously in business. And it may be we have a program in the coming weeks to refresh, or even coming week, to try and get some momentum to refresh COVID safe plans and help business and other groups work through that, because that is a very real issue and has come through very strongly tonight. We'll also take on board whether or not through that program we do a separate forum, maybe not so much health related, but specific to industrial relation and support for businesses and employees and employers to work through payment and the like. That has come through very strongly in the chat. As we finish, I encourage everyone to understand that the importance of testing, you've heard it tonight, is so important, and we have been fantastic. Please keep those testing numbers up. It gives us a sense of truth for Jerome and others tomorrow to make that decision. I have no idea what the decision is going to be. I wait like everybody else to hear whether we're locked down or not, but that testing and that constant assessment of our community is important. So if you have symptoms, you're unwell, you please follow that through. And most importantly, it's about looking after each other as a community and supporting each other through what is a challenging time. So I thank everyone for being with us. We are happy to run more forums. We are not closed off to, not running one of these Tuesday next week if this continues. So I thank everyone for being with us, and we've had a huge Facebook contingent as well. So I thank you. I wish everyone good night, and please stay safe. Thank you.